1,228 new cases of COVID-19 and 28 more deaths today. More than 57,000 tests were completed for a positivity rate of 2.2%. 331 new cases were in Toronto, 228 in Peel, 132 in York, 47 in Durham, and 40 in Halton. As of 8 p.m. yesterday, more than 540,000 doses of the COVID-19 vaccine were administered in Ontario. And yesterday, Canada reached the milestone of more than 1 million Canadians who've received at least one dose of a COVID-19 vaccine. Canada is set to receive more than 250,000 doses from Pfizer in each of the next 3 weeks, as the company makes good on a promise to deliver 4 million doses by the end of March. Ontarians 80 years and older will soon be invited to book their COVID-19 shot. This is part of the province's expansion of its vaccination program. Officials say those appointments will start being offered sometime next month. Public health units are still working out how to get in touch with those eligible for the vaccine, as online registration portal is now being set up. Dr. Alan Grill from Markham Stouffville Hospital talked to us today about the province's plan to vaccinate residents aged 80 and up against the COVID-19 virus.
I would say that primary care providers, which include family physicians, they almost have three key roles in this rollout. So we need to educate, so we need to give our patients information about the importance of the vaccine and the safety of it and why it's so key that when their turn comes up, they line up and roll up their sleeves to get vaccinated. We need to collaborate with our public health units in their rollout plan and advise them on how primary care can play a role. And obviously, we need to help vaccinate. And so when it comes to the next rollout in the 80-year-olds, we will definitely be part of the communication plan.
Mayor Tory says extra staff are being trained to operate Toronto's mass vaccination sites. The city says all 9 of its facilities are on track to be up and running by April 1st. The clinics will be able to administer more than 120,000 doses each week once they're fully operational. The CEO of the Ontario Pharmacists Association, Justin Bates, spoke to us today about how pharmacies in the province can better support the COVID-19 vaccine rollout.
Certainly the COVID vaccine is much more complex. Everything from the screening and assessment of the patient perspective, as well as even how we draw the doses from the vials. So the Moderna one is an example. While it can be stored at temperatures of 2 to 8 degrees in a fridge, once you puncture the vial, you have to use 10 doses within 6 hours. So there is more complexity in the administration functions.
Education Minister Stephen Lecce toured a school in Vaughan today being set up to administer asymptomatic testing. As part of the province's enhanced return to in-person learning, school boards have been asked to conduct testing in at least 5% of schools. In Toronto, that means 40 schools a week. Sites are being identified, which will act as a feeder to nearby schools where students, staff, and families can take part in the voluntary saliva test.
We've created a point of access for teachers to get a PCR test at a pharmacy, expediting their results and really giving them an easier way to get a test right in their communities via pharmacy. So for teachers and staff, it is more easier. And for our students, it's more accessible because it's in our community centers, it's in our schools, it's right in our community, and we're trying to step up that testing to make sure that parents know we'll do whatever it takes to keep their child safe and just keep these schools open, which is our priority.
Ontario has set aside 50,000 tests a week, hoping that at least 2% of student populations are reached.
The way I kind of look at all these new rapid tests that are coming out that are being approved is it's just more additional information. So, for example, the government has done a really good job at expanding who can actually administer those tests. So that's why we're starting to see them in the community. I think, when I heard about these rapid tests, I thought it would be really nice for us in the future, like I'm talking months ahead, to be able to be in a situation where you and I could go somewhere and get a rapid test, and maybe for the day we're clear because we have something to say we're clear. Like that would get everybody back to normal